Hi, I'm Niall Walker. I am a insurance agent. I've been own my own agency. I've been in the insurance industry for almost 40 years, and been working with Medicare for about the last 7 years. I started working with Medicare because I had so many clients asking questions, and I just had no idea how to advise them. So after now becoming contracted and taking the exams and everything required by Medicare in order to offer Medicare products, now I understand it. Although the rules change a little bit each year, and so constantly we are required every year to go through recertification, both by CMS, which is Medicare, and by every company that we do business with that are contracted to sell their products. And so I spend just about a month every year just before the open enrollment for Medicare Advantage plans in training again, so I'm in compliant with Medicare for the next year. It is highly regulated, and most insurance agents are not contracted to sell Medicare products. So be careful when you begin to talk to people about Medicare that they are actually capable and are legally able to discuss Medicare products. So today we're going to be talking about Medicare Advantage plans. I've already talked about original Medicare Part A and Part B, why you may need to supplement those plans or choose a Medicare Advantage plan over solely Medicare Part A and Part B. So I've talked about Medicare Medicare supplement plans and the Medigap plans, and also about the prescription drug plan. So look for my YouTube videos and look at those as well. In fact, I'd probably look at those before I look at this one. So that you get an overview of what original Medicare provides, why you might want to supplement original Medicare or choose Medicare Advantage as an alternative. So, Medicare Advantage. About 15 years ago, there was pressure from Congress to make a privatized option for Medicare available. And that's really what Medicare Part C is. It's getting your Medicare Part A and Part B hospital and doctors coverages through insurance companies, much like you've been doing for years through your employer's group plan or your individual plan. So when you look at a Medicare Advantage plan, they look very similar, very similar to your old standard group health plans. However, in reality, in most plans I've looked at, they're significantly more rich, and you pay less out of your pocket than what you do under your employer's plan. They're actually very, very good. So let me give you some general information first before I go into the plan itself. So first, when it comes to Medicare Advantage or Medicare Part C, Medicare wants to make sure that you have the ability to review those plans and enroll in those plans and be able to change the plans when you want to. So there is an open enrollment period every year between October 15th and December 7th, which gives you the opportunity to review the plan that you're currently on and what it's going to do next year, starting in January, and all the other plans that are available, and compare them and decide whether or not you want to switch plans. During that open enrollment period, you can move from original Medicare to a Medicare Advantage plan, or you can move from an original Medicare with a supplement to a Medicare Advantage plan, or you can move from a Medicare Advantage to another Medicare Advantage plan during that open enrollment. That enrollment ends December 7th, and once it ends, you will remain on that same plan, which starts January 1st through December 31st of the following year. So you cannot move once the open enrollment closes. You're with the plan that you've chosen once that's done. The other thing is, with the open enrollment, you can change plans regardless of your health. You can need a hip surgery and have it already scheduled for February 2nd and make a change in November to a different plan, and that plan will pick you up January 1st, and the benefits of that plan is what's going to address the surgery in February the following year. So it's not uncommon for me to see somebody that will choose a less expensive Medicare Advantage plan, and then once they are diagnosed with something that needs to be done, may change the plan in the future year for one that may cost them a little bit of money, but has maybe a little richer benefits. So again, that open enrollment is available every year. The other thing is there is an open enrollment when you first become eligible for Medicare. So whether it's when you turn 65 or when you lose your credible insurance through your employer, you have the ability during that time period to also enroll in the Medicare Advantage plan. So I would suggest that you have the opportunity to enroll in it. I believe it's 60 days prior to 60 days after you lose your credible insurance. So there is a window. It is a short window. You can go to Medicare.gov to confirm the time I've told you whether or not that's exact or not. But there is a time frame that you have to do that enrollment. Otherwise, you'll have to stay on original Medicare until the open enrollments happen in the fall. Medicare wants to make sure these insurance companies provide the very best benefits they can, and they serve you well. So they give these Medicare Advantage plans star ratings. The star rating is 1 through 5, 5 being the highest. Now, insurance companies that can maintain a 5-star rating get paid by Medicare a little more in their premiums than those that do not. So all the insurance companies are trying to satisfy you as a consumer because they would love to have a 5-star rating and be able to get the maximum amount from Medicare to pay for your plan. The other thing that they do is that 5-star rating is based on how you're treated, complaints, how quickly things are processed, how well you recover from whatever the treatment is. So again, I would look at those ratings. It's hard to get the 5-star. Most of the plans that we have here in the greater Seattle area are going to be probably a 3.5 and 4-star. I think we do have one here that is a 5-star, but it's a new plan that's new in the area. That rating was generated by where they do business in Portland. Whether or not they can maintain that here, we don't know yet. But anyway, all of these plans are very, very good. And they have wonderful customer service departments that you can call if you have questions and need help with receiving some answers. Those plans are available to you either directly by the insurance companies, or you can work through agents that are contracted with them who can help you in selecting the plan that's proper for you and help you get the enrollment. During the open enrollment period, when you get to the age of 65, you are going to be buried in mail because Medicare does not allow us to contact or solicit you directly. We cannot call you, we cannot email you, we cannot walk up to you in the store and ask you what you're doing about your Medicare, or on the street. We cannot go door to door and knock on your doors. The only thing we can do is send something by U.S. mail to your home, or you can find us somewhere else and come looking for us. But we're not allowed to aggressively solicit you. Because of that, you got to look a little bit in order to get the assistance that you need if you're wanting some help in selecting a proper Medicare Advantage plan. We also get commissions paid to us by those insurance companies. That's how we are able to provide that service to you. It does not change your costs whatsoever. That commission is paid to us. And whether you go directly to the plan and enroll or you come through us to enroll, your cost is exactly the same. These plans are designed by county. So an insurance company that offers plans in Snohomish County, which is the county I reside in western Washington, that plan is designed here, the doctors are here, and if I move to a different county, then I have to enroll in a new plan. Because these plans are designed by county. There is a new open enrollment period whenever you move, so you can select plans in a new county. The Medicare Advantage plans are readily available typically in your metropolitan areas. They may not be available in your rural areas. Rural areas, your only choice may be original Medicare with a Medicare supplement. But there are some counties that are adjacent or close to some of these metropolitan areas that may have some of these Medicare Advantage. So again, you're going to have to look by county, and you need to work with somebody that knows what's available for you so you can take a hard look at the Medicare Advantage and decide whether or not that's your best option. Medicare Advantage plans, though, are Medicare. And so they do cover the Part A or the hospitalization, they cover the doctor's visits and chemotherapies, they cover all that kind of stuff, and they cover their prescription drug coverage. And they're all in one package policy. These policies are, in our county and in our area, they are all either an HMO or a PPO. HMO is a health maintenance organization, PPO is a preferred physicians organization. An HMO requires you to select your primary care doctor You need to see that doctor, and if you need a specialist, he refers you to the specialist. You have to stay in the network. You cannot leave the network. If you leave the network, there is no coverage. So it's very important that you understand your network, or you're working closely with the doctor you've selected as your primary care physician, and that he's referring you within the network. And they're very good at that, and that's going to happen because they are contracted. For instance, here we have some very large clinics associated with hospitals, and they're going to keep you within their system. The other type of plan, network plan, is your PPO, or preferred physicians. They're very similar to the HMOs in that you do have a network of doctors. Does not require referrals. You do not have to pick a primary care doctor. You just have to make sure the doctors you use is part of that network. So it does require you to be familiar with the network and to look up in the directory, make sure whatever specialist you're seeing or whatever doctor you're seeing is part of that network. Now, if they are not part of the network, typically those plans will still pay for the doctor, but your out-of-pocket expense will be much higher. So for instance, if it's an 80% coverage under your in-network doctor, it may only be 50% coverage outside of your network. So be very, whether it's a health maintenance or a preferred physicians organization, you want to stay aware of what the network is and stay within your networks. The number one complaint we have with Medicare Advantage plans is the complaint that their doctor is not part of the network. So you can avoid that by making sure you're selecting the right plan that has the right network for the doctors you're using, or be comfortable with the physicians and the medical practices that you're going to be using with your plan and stay within that system. Now let's talk a little bit about the Medicare Advantage plans themselves. Because Medicare is paying for the majority of the premium of these plans, because they're not offering you the Medicare Part A original and the Medicare Part B original, they're sending the money to the insurance company to provide these Medicare Advantage or Plan C plans, then there's the majority of the premium, or in some cases all the premium, is being paid by Medicare. So it is in our county, in Snohomish, King, and Snohomish, King, and Pierce County, there are multiple plans that have zero premium. So the only premium you pay is your Medicare Part B original premium of $134 that you have to pay Medicare. Medicare takes that $134 and sends that with the rest of the money that they send to these insurance companies for the Medicare Advantage, and then they provide the plan. Now let me give you a summary of what these plans may look like. Now the plans do change from year to year, and the plans may have different co-pays, and some of them may have a premium and some may not. But in our county right now, a zero premium plan often will, besides the $134 you send to Medicare, you don't pay them anything, and they have no deductible. However, when you go see a doctor, you'll pay a doctor like a $15 copay, a specialist a $45 copay. If you're having surgery, you may pay 20% of the bill and they'll pay 80% of the bill. If you go to the hospital, you'll have like a $440 per day copay, but that only goes to day number 4. Then after that, they pay 100% of everything. These plans also have stop losses or maximum out-of-pockets. So if you have lots of health issues and lots of health charges, then once you reach a stop loss or a maximum out-of-pocket of $6,700, or some plans that may be $4,200, then they're going to pay 100% of that after that. These plans will limit your out-of-pocket catastrophe expenses because they have those maximum out-of-pocket caps. If you pay additional premium, the co-pays will be lower. You also will find that instead of having a 20% outpatient co-insurance, you'll probably have a flat like $250 or $300 co-pay. So if you have a surgery that's outpatient, it's an $18,000 bill, you pay just a flat $300 rather than 20% of the $18,000. I would suggest that you work closely with an agent when you begin to look at these plans, so that you compare plans from each other, and both by what's being offered by the same insurance company, but also what's being offered by multiple insurance companies. If you do that, you'll be able to find the plans that have the best network for you and you may decide whether to pay a little additional premium to have lower out-of-pocket expenses, or whether you decide that the zero premium plan is wonderful and will fit your needs just fine. Medicare Advantage plans also provide coverage worldwide, so you can be anywhere in the world and the plans will still provide health insurance coverage for you. Now, these are both PPOs and HMOs are for the county that you're in. So if you are traveling outside of your county and you have a medical emergency, they have to pay just as if you were in your network in your county. So if you're here in Seattle and you decide to make a trip to Florida, and while you're in Florida you fall down a flight of stairs or you have a heart attack or whatever, that emergency that you have to receive medical treatment for, you don't have to worry about them being in the specific network. The network may not even exist where you're at. You just go and get your emergency work done. They have to pay as if you were here inside your network, so your deductibles or your co-pays or all that kind of stuff will be the same. Just be aware though that if it's not an emergency, if you want to have a bunion removed or you want to have an annual physical or whatever, and you're outside your service area, if you decide to do that, you'll be paying the bill yourself. Unless it's the PPO, and then you'll be paying that out-of-network higher copay. So again, I would highly suggest take care of yourself when you're at home, do all the normal things you need to do to review things with your doctor while you're here, but be aware that when you're traveling there is emergency care for you. Now, worldwide care for emergency services is included, but there is one cost that often, I shouldn't say often, but we do see, and that is the emergency transportation. So for instance, you may have somebody that's in a third world country, they've been injured somehow and they want to be flown back to the United States to receive their surgery or whatever. That travel expense is not going to be covered by your Medicare Advantage plans. It's also wouldn't be covered by your Medicare supplement plans. If you're concerned about that, there's lots of travel insurance that's available that you can purchase on an individual basis to the countries you're traveling. In some cases, you might even be able to get that through your credit card as you're purchasing those airline tickets and other things. So that's something you may want to be aware of if you're doing private traveling now that you're retired. I hope this was helpful. I can't go into specific details on each plan that's available and what your out-of-pocket expenses are going to be because they vary from company to company and they change as each year comes along. So you need to work with an agent that's local, and he can be able to review with you the various plans that are there. Because we can't solicit directly, and the only thing that can be sent to you is by mail, be aware that every year during this time period you are going to get tremendous amounts of literature. You're going to get information about standalone drug plans, Part D. You're going to get information about Medicare supplements or Medicare gaps, Medigap plans, which is supplementing Part A and Part B. You're also going to get tons of literature from the Medicare Advantage Plan C plans. All these are going to show up in your mail at the same time, and you'll probably have 10, 20, 30 of these booklets, and they're not talking about the same product. So that's one of the reasons we find that Medicare patients and enrollees are so confused, is because they're getting information about all three types of Medicare plans available: the standalone drug plan, the Medigap or supplement plan, and the Medicare Advantage plans. Please use our expertise and contact us for help. We can make it a little easier for you, and once you're done, you'll feel confident about the selection you've made and how it's going to provide coverage for you and your medical expenses. Appreciate that. If there's anything else, additional information you may need, again, I would suggest you go to medicare.gov and review that information there, which will be in much greater detail. Thank you.